Many adults enjoy drinking a few alcoholic beverages, but how can you tell if your alcohol consumption is unsafe? If you're questioning whether your drinking habits are cause for concern, you should know that the threshold for harmful drinking is much lower than you might imagine. Millions of people drink beer, wine, and spirits without developing a drinking habit that causes problems. However, your alcohol consumption could still put your health and well-being in jeopardy even if you don't develop an alcohol use disorder. How much alcohol can you drink at a safe level and still be considered a low-risk drinker? How much alcohol consumption would place you in the high-risk group? According to extensive research by the National Institute on Alcohol Abuse and Alcoholism, NIAAA, fewer than 2% of people who consume alcohol within the established guidelines ever develop alcohol use disorders. Point 1. Here's what you need to know about the guidelines for alcohol consumption if you are trying to assess your risk. Men. 4 or fewer drinks per day for men. Low-risk alcohol consumption is considered drinking 4 or fewer standard drinks on any single day and less than 14 drinks during a given week. According to the NIAAA, both the daily and weekly guidelines must be met for a person to remain low-risk. Point 2. In other words, if you are a man who only drinks 4 standard drinks per day, but you drink 4 every day, you are drinking 28 drinks per week, which is twice the recommended level for low-risk alcohol consumption. Drinking 4 drinks per day 4 times a week would also exceed the guidelines. Women. 3 or fewer drinks per day. Research has shown that women develop alcohol use disorders at lower levels of consumption compared to men. Therefore, the guidelines for low-risk drinking are lower for women. The NIAAA guideline for low-risk consumption for women is 3 or fewer standard drinks a day and no more than 7 drinks per week. Point 2. Again, both the daily and weekly standards must be met to remain in the low-risk category. If you're a woman who only has 2 drinks a day but you have 2 drinks every day, that's 14 drinks per week, twice the recommended amount for low-risk consumption. It's important to keep in mind that the guidelines vary from one country to another. Heart health and longevity. When considering the NIAAA's consumption guidelines, it's important to note that low risk doesn't mean healthy. In fact, the low-risk category of drinking may not be the best level for heart health. One international study that looked specifically at the risk of cardiovascular disease found that consuming an even lower amount of alcohol may help you live longer. Point 3. The study involved nearly 600,000 adults from all over the world who did not have a history of cardiovascular disease. The participants drank between 0 and 350 grams of alcohol each week. To put this figure in perspective, the recommendation for men in the US is equivalent to 196 grams, about 6 glasses of wine. The study found that drinking 100 grams or less of alcohol per week had the lowest risk for mortality. Low risk does not mean no risk. There are some situations in which no level of drinking can be considered low risk. Depending on your age, health, and other circumstances, you may need to drink even less, or not drink at all. Here are some circumstances in which you may need to stop drinking altogether. You are taking certain medications that negatively interact with alcohol. You are pregnant or trying to become pregnant. You have certain medical conditions, including cirrhosis of the liver, hepatitis C, or chronic pain, as well as some heart conditions and mental disorders. You plan to drive or operate heavy equipment. A personalized approach. The NIAAA guidelines are for the average person. Thresholds vary greatly, and there are many factors involved. It's best to take a personalized approach to find a safe level of drinking for you. Harvard Men's Health Watch suggests that you speak to your doctor to determine how much alcohol is safe for you to consume. Point 4. Your doctor can take your entire medical history into account to make an accurate recommendation. The amount of alcohol you consume might need to decrease as you age or if you need to keep certain health conditions, like your blood pressure, under control. It's important to keep in mind that what is considered safe and healthy for you might not be the same as it is for someone else.